Ladies and gentlemen, welcome to our noon lecture. I'm Robert Jackson. I'm chairman of the Center for Performing Arts Medicine, and it's my distinct pleasure to welcome you all here. And it's my distinct privilege and pleasure to introduce my friend and colleague, Dr. Richard Fish. Dr. Fish is a native Houstonian. He went to the University of Texas in Austin and graduated Phi Beta Kappa. He then went to a small medical school across the street called Baylor College of Medicine and did his residency at the University of Alabama Birmingham Eye Foundation. He then did a retina fellowship at the California Pacific Medical Center and then returned to Houston after a brief sojourn in Dallas. And Dr. Fish is a physician member of the Center for Performing Arts Medicine, but he's also a musician. He's a percussionist, and he plays in several bands, but the most interesting band that I think is called Double Vision. And so maybe he'll talk to us about that. Richard has lectured extensively and published on visual problems of artists, but today is a special treat because he published a book that he'll lecture on today, The Blind Musician, Historical, Ophthalmic, Musical, and Neurological Aspects of Gifted Artists. Please give a warm welcome to Dr. Richard Fish.
Thank you, Robert. Well, it's a real pleasure to be here to talk to you guys, and I'm just really gobsmacked by, a really wonderful turnout. So thank you all for coming and spending your lunchtime with us. A couple days ago, had the privilege of giving this same lecture at my alma mater at the University of Texas. It was also a chance to visit the Blanton Museum. Jack Blanton was a great donor to the Methodist Hospital, a great friend of the University of Texas, and to see the museum that bears his name and to see some of the ways that the campus has changed was a real privilege. So Austin on Wednesday, Houston on Friday. A friend of mine said, "Dude, you're doing a book tour." And it's like, I don't know if that's true or not, but anyway. So a little bit more about CPAM. Most of you in the room know about the Center for Performing Arts Medicine, but founded by Dick Stasny, and now Robert is doing a great job along with Todd Frazier to carry this into the next era. The Center for Performing Arts Medicine is a conglomeration of physicians who treat artists with physical issues and disabilities and injuries. So a ballet dancer that has a sprained ankle, an opera singer that has a strained vocal cord. These people seek out the best physicians that are here at CPAM for their treatment. So an ophthalmologist doesn't get a lot of CPAM patients. So at some point I decided I would like to try and contribute something to this great organization, and I stumbled into that contribution by way of these two books that I really want to recommend to you. So on the left, The Artist's Eyes is a book by Mike Marmer and James Ravin, and in it there's just a wealth of information about eye diseases of very prominent artists, and I'll give you just a snippet of that. And several years ago I kind of put together a talk and excerpted some things out of Marmer's book, and it's just super interesting. And likewise, I came across this other book by Oliver Sacks, the noted neurologist who recently passed away, and it was called Musicophilia, and it's just a collection of vignettes of very interesting neurological syndromes that happen, around and related to music. So in one story, somebody gets struck by lightning and all of a sudden can play concert piano. And he just goes on and on with a lot of different chapters like that. So a few years ago, I gave this talk on The Artist's Eyes, kind of excerpted from Marmer's book. And in it, we talk a little bit about some very prominent artists. Claude Monet, one of the founders of French Impressionism, suffered terribly from cataracts later in his life. So Monet, who's very well known for his water lilies and other beautiful paintings of the French Impressionistic movement, would often paint this subject, the bridge at Giverny. So in 1900, he executes this beautifully in a wonderful color palette. By the time he now suffers with severe cataracts in both eyes in 1922, the painting on the lower right just turns into a big, hot, stinking mess of almost abstraction. This painting, by the way, is sitting at the Museum of Fine Arts in Houston, and it just shows the effect of his profound cataracts on his output. Likewise, Edgar Degas, another French Impressionist, would paint these exquisite scenes of girls at the ballet and ballet school. He begins losing vision in his 30s to something that we don't know what it was. It perhaps was some sort of hereditary retinal degeneration. He begins losing central vision, and even late in his career, he's still executing works of ballet, but he's changing into different media. So he's now using bronze and sculpture and pastels, and you can see that they're just rendered in a much more coarse fashion because of his vision loss. In the book, it also talks a little bit about color blind. We don't really use the term color blind. We, in ophthalmology, talk about color deficiency, the most common of which is red-green color deficiency. But there are a couple of artists who were color deficient. Paul Henry, the Irish landscape artist, painted, you can see here, in blues, browns, yellows. So people with red-green color deficiency, they can see some color, but they cannot differentiate red and green. And just like the French etching artist Charles Marion, whose only work in color is shown here, again, yellow, brown, and blue, but absolutely no reds or greens. So there have been a handful of painters who were color deficient. Also in the book, it talks a little bit about some of the other prominent artists with eye diseases. Edvard Munch, Camille Pissarro, Georgia O'Keeffe, all of them suffered at one point in their lives with some sort of visual impairment. So again, I sort of, tried to figure out what could be my little contribution to CPAM, and again, having read Oliver Sacks's book, and you may remember Oliver Sacks from the movie Awakenings, in which he's played by Robin Williams, and the story of these catatonic patients who are sort of brought back to life with L-DOPA treatment and then sadly kind of sink back into their catatonic states. But Sacks has this great book, and in it, I remember being particularly, caught with this part of his book. Musicians' brains are somehow different than non-musicians' brains. He talks about the difference in anatomy with areas of the motor cortex, the auditory cortex, the corpus callosum, the structure that connects the two hemispheres, and those are all larger in musicians than they are in non-musicians. In fact, if you go into a neuroanatomy lab, you can tell the musicians from the non-musicians, but you can't tell scientists, doctors, architects, anything else, but you can pick out musicians just based on neuroanatomy. So, as Robert said, yes, I'm an ophthalmologist. I'm on staff here at Methodist. I was actually born here at Methodist. And I also am a very passionate musician. So I play in a number of different bands. And around the time that I started losing hearing in my left ear, but not because of drums, I started getting very interested in the impairment of artists, performing artists, musicians, and that's how a lot of this sort of all converged into me writing this book, The Blind Musician, available on Amazon. All profits go to charity. And it led to a very cool photo op with Stevie Wonder last year, and got to say hi. And I so wanted to interview Stevie and ask him a few questions. It sort of never came to pass. He was pretty tired after his show. But anyway, it was a very cool photo op. So what we'll be talking about today, we'll talk a little bit about blind composers. If you sort of look at the history of art, you can find the image of a blind musician scattered throughout Western and non-Western art. It's a very compelling image. It becomes a subject matter in a lot of works of art. So dating back to even the tomb painting from about 1100 BC, through Rembrandt's etching of a blind fiddler, through Picasso's Blue Period, the blind guitarist, you can find that image because it's just so compelling. The image of a blind musician is just a very compelling image throughout history. One of the first blind musicians may very well have been Homer. Academically, there is a lot of debate about who Homer was. Was he one guy? Was he a bunch of guys? Was it a school? But epic poems, the kind of which that Homer wrote, were almost always sung. So if there was a single Homer, he was very likely a singer. Well, in all the academic debate about who was Homer and was it more than one person, the one thing that is pretty much universally depicted about Homer is that he was blind. So Homer may very well have been our first blind prominent musician. Similarly, Blind Harry, the person who was responsible for transmitting this huge epic poem, about William Wallace and his, his struggle for freedom against the English, which became the basis for the movie Braveheart. Blind Harry's Wallace is this enormous epic poem that was published. It becomes the most popular work in Scotland, second only to the Bible. And again, there's some academic debate about whether he was really the author of that, but again, the blindness seems to be a pretty constant figure. There were blind Gaelic musicians in Ireland and Scotland. Harpists and pipers had the word Dáil, which is Gaelic for blind, that was added to their names. Blind children were trained up in these instruments, and it's worth noting that many of these cases of blindness were due to smallpox. So I was at the University of Texas the other night, and I was talking to people about, there's this crazy anti-vaccination thing. I said, well, this is actually one of those things that we eradicated from the surface of the earth, and that was declared eradicated in the year that I matriculated to the University of Texas in 1977. So in the early 20th century, as American blues is coming into being, the name blind becomes like an honorific badge that is placed upon a lot of blind blues musicians in the early part of the 20th century. So there's a whole host of people. Again, the Spotify playlist has got a little sampling of each of them and kind of why they're important. But it just becomes a very common thing that record companies and publicists use to put these people on the map. A really interesting story, and I consider myself pretty well read and know a lot about ophthalmology, know a little bit about music. And one of the things that just completely surprised me was this story of Blind Tom Wiggins. Blind Tom was a slave born into slavery in Georgia, sold to a General Bethune. He taught himself to play. The story goes that he spent a lot of time under the house of his masters and listening to the general's daughters play piano. One night he comes in and just starts playing. The general discovers that he's got a hit and potentially moneymaker on his hands and starts touring him around the country. He was probably an autistic musical savant. He had a very limited vocabulary, but he was supposedly possessed a musical repertoire of over 5,000 pieces. He becomes the first person to play in the White House who's African American. He also did this at the age of 11. He was also very imitative, so he took sounds that he heard from nature, sounds that he heard from the battles. Remember, this is Civil War South, and he incorporates them into his compositions. He's also very deft with verbal interpretation. So he once heard Stephen Douglas talk at a lecture, and he begins imitating Stephen Douglas's inflections in speech, and he could, during those speeches that he would imitate, he would also pause for the heckles and catcalls that he heard from that speech. He tours extensively through the United States. He ends up earning the equivalent of about $5 million in today's dollars, and of course, being a slave, he ends up earning or receiving none of that. So the Civil War ends, and because he's an impaired person who can't take care of himself, and because he's also a money earner, he ends up being the subject of a very, very difficult and prolonged custody battle. So it takes 22 years, lawsuits in several different states, and finally, in 1887, Tom and his mother and the Bethune widow end up winning emancipation for Blind Tom. He becomes known in the newspapers as the last American slave. So I'm going to cover a lot of different blind musicians here, so we're kind of moving it lightning round here. Art Tatum was considered by many people, including most jazz pianists, to be the greatest jazz pianist who ever lived. We don't know exactly what the cause of his blindness was. And by the way, in doing all of this research, so I write this book, I'm researching, I think, okay, I'm going to get access to medical records, I'm going to really dive into, what caused these people's blindness. And no way, it was impossible. These people, number one, many of them were from the distant past. The ones that aren't grew up almost exclusively in terrible poverty with access to very limited medical care. Because these blinding events happened in their childhood, they have no personal memory of it. They have stories that were told to them, many of which are inaccurate. So the task of trying to figure out what blinded these people is really difficult. And so there's just little bits and pieces that we have about the medical or ophthalmologic conditions that blinded these people. So we don't know about Art Tatum and what caused his blindness. From the photograph, you can tell that his left eye has either been removed or what we call tisicle, just shrunken up, and the right eye's kind of looking at the camera, but maybe turning a little bit outward. It's thought that he probably had some kind of vision in that right eye. Ray Charles, everybody's seen the movie Ray with Jamie Foxx? Terrific film. And in it, it depicts what's probably the best known account of how he lost his vision, which is congenital glaucoma, but we don't know that for sure. He begins losing vision at the age of 4, completely blind by the age of 7. He has both eyes enucleated, the word we use to surgically remove an eye. And this is one of the few photographs of Ray Charles without his trademark sunglasses. The story of how that came to be is kind of an interesting story. His publicist thought that the appearance of a pretty handsome guy like this without any eyes would be a little distressing to the American public. So a retouch artist painted a pair of sunglasses on one of his first PR photos. That becomes his trademark look. He starts wearing dark glasses to all his performances, and that is how Ray Charles gets his sunglass look. Ray was a pretty colorful fellow and a great admirer of Art Tatum. I'll let you read his comments about Art. Ray Charles is just an amazing talent who, at the time, was able to bring genres of music into the mainstream, predominantly white American public of the 1950s and 60s and kind of normalize and even make popular a kind of music that had never been popular in that demographic before. He's really remarkable for what he accomplished, let alone as a musician. So what did he have? Well, congenital glaucoma is a pretty rare condition. It usually affects both eyes. It can cause blindness in up to 15% of cases. Patients usually present with tearing, severe light sensitivity. They kind of squeeze their eyelids really tightly. They develop swelling of the cornea, corneal edema, high pressures in the eye, and eventually a condition called buphthalmos, where the eye becomes enlarged. Buphthalmos means ox eye, and they develop these very large eyes. The treatment of this is very straightforward today. We don't put drops in congenital glaucoma patients like we do adult glaucoma patients, too hard to administer, and besides, there are very, very good surgical treatments for this condition. So this is actually a great example of a condition that is no longer, likely to blind someone. Doc Watson was a country blues and singer, guitar player, banjo player. He's a great picker. A guitar picker, banjo picker. In his biography, we don't really know what caused his blindness. So there's a photograph here that shows pretty bad corneal scarring in his left eye, a little bit of corneal scarring in his right. We don't know the precise etiology of that, but the interesting snippet from his autobiography is he was told that in 1962 that he was not a candidate for corneal transplantation because he was 40 years old. So that is no longer the case. We do corneal transplantation, ophthalmologists do, on all sorts of ages. There's really nobody that's too young or too old. Corneal transplantation is the most successful tissue or organ transplant procedure in all of medicine. It's the lowest rejection rate, the highest success rate. So it's a remarkable sight-saving procedure for many, many people with corneal disease. Jeff Healey was a blues jazz guitarist who had bilateral retinoblastoma. He had both eyes removed at the age of 11 months. He starts playing guitar at the age of 3, and he plays it in what, kind of a Hawaiian style, which is horizontal because he's just a little kid, but he retains that unusual playing style for the rest of his career. Because he had bilateral retinoblastoma, retinoblastoma is a tumor of the retinal cells, so he actually has cancer of the retina. He had a genetic form of cancer. Genetic cancers frequently give you cancers in other parts of the body. So he ends up dying at a young age of osteosarcoma and lung cancer. And because he had a genetic form of the cancer, he passed it along to his son Derek, who the last time I researched this, Derek also had bilateral retinoblastomas. He had them treated locally, meaning the eyes were not removed. He has intact vision and intact eyes in both eyes. So what did he have? Retinoblastoma. These are pictures of a retinoblastoma before and after treatment. These slides are from my partner, Amy Scheffler, who works here at Methodist to treat ocular tumors, little babies she treats at a hospital down the road. But patients come in with this large white tumor, cancer of the retinal cells here, that just occupies the entire posterior part of the retina. She infuses these little catheters all the way up until it gets to the ophthalmic artery, infuses chemotherapy, and we're able to save these eyes. In this particular case, can't really save much vision because the macula is involved here, but the peripheral retina is intact, and these tumors are just treated in a far, far different fashion than they were in Jeff Healy's day when we used to enucleate eyes. Well, the undisputed king of blind musicians, at least in my view, is Stevie Wonder. He was born 8 weeks premature, birth weight of about 4 pounds, and suffered from retinopathy of prematurity. There's been very few musicians who have been as honored and revered in our culture and whose music has just woven itself into the fabric. And he does this from the age of 11 until current day, and is a brilliant composer. And I mean composer in every sense of someone who can craft a melody, counter melody, harmony, orchestrate, and do everything, all himself. And then he ends up playing on many of his albums every single instrument. He's a great pianist, obviously. He's also a killer drummer. I mean, he's got drum licks that are just incredible.
Don't you worry about a thing. Don't you worry about a thing, mama. All on this night again, the sun reaching out.
So what did he have? Retinopathy of prematurity is pretty rare in the developed world now. It's a condition in which low birth weight babies are put into an incubator. That incubator has high oxygen content. That oxygen turns out to be damaging to the retinal blood vessels that are still growing at the time of these early premature babies. So the supplemental oxygen that they receive causes blood vessel growth in the peripheral part of the retina. Those blood vessels bleed, scar, detach the retina, and lead to blindness in untreated cases. Well, now that is very rare. We have extremely aggressive screening protocols in NICUs. Oxygen levels are very carefully titrated and controlled. And treatment has evolved just in the 30 years that I've been practicing. We used to freeze, cryo all these patients. Then along comes the revolutionary treatment of laser, and now comes a revolutionary treatment in which we inject blood vessel inhibiting drugs called anti-VEGF drugs in, and it suppresses that blood vessel growth while the rest of the retinal circulation can still form. Andrea Bocelli suffered from congenital glaucoma and lost all remaining vision at the age of 12. This picture is a great photograph from his memoirs because it shows him as a toddler with all of the signs of congenital glaucoma. So he's got buphthalmos, remember that enlarged eye. He's got this kind of cloudy looking cornea. I mean, a normal photograph would have a nice crisp light reflex on it, so you can see the corneal edema that's very characteristic. So you can see him in the late stages of congenital glaucoma. And unlike other artists who wear dark glasses, some of whom have prosthetic eyes, Bocelli has always just gone around what we call anophthalmic, meaning he doesn't have eyes and he doesn't have prostheses in there. So I'm going to shift gears and talk a little bit about composers with sensory loss. So the story of Beethoven being deaf is pretty well known. He starts losing hearing at the age of 28, and by the age of 50, as he's composing his latter works, he's totally deaf. Not a problem for Beethoven. He's a genius. He can hear melodies in his head. He can play them on the piano. He can transcribe them onto manuscript. A blind composer, on the other hand, before the advent of computers or MIDI interfaces, which allow you to sit down at a keyboard or whatever and just play anything you want to, and it just gets, transcribed by a computer, blind composers had to find somebody to help them transcribe music. So Joaquin Rodrigo, the great Spanish composer, whose most famous piece is the Concierto de Aranjuez. Well, Rodrigo was blinded by diphtheria, another one of those diseases we can vaccinate people for. He composed all of his music in Braille. So, fun fact, Louis Braille, the person that invented the alphanumeric notation system for the blind of these 2x6 cells, was also an organist, and he developed a very elaborate musical notation system so that the note value, the dynamics, the pitch, everything about a note that you could possibly want to know is translatable into Braille. And Rodrigo used Braille exclusively to transcribe his pieces. Other people, George Friedrich Handel, lost vision in his left eye, then his right eye, late in his life. He was not blind until later on in his life. He had a condition at the time that was known as gutta serena, which was blindness without any visible damage. In other words, there's no corneal scar, there's no cataract visible. The use of instruments to look at the back of the eye was unknown at the time. And so he might very well have had something like a stroke of the optic nerve, something we call ischemic optic neuropathy. He underwent 3 very unsuccessful surgeries, but towards the end of his life, as he was blind, he had to have something called an amanuensis, a scribe, which was his friend John Christopher Smith, to transcribe his music. Well, there's an interesting story that's kind of a sidebar to Handel's tale. The Chevalier John Taylor was the first ophthalmic quack in history. The guy ends up riding into town with elaborate carriages with all of the servants dressed in their finest livery. He operates with gold-plated instruments. He advertises himself as being the eye surgeon to kings, queens, and princes. We know for a fact that he operated on and blinded Johann Sebastian Bach late in his life. Bach ends up having unsuccessful surgery, complications, bloodlettings, poultices, everything else, and ends up dying within a year of having had cataract surgery. In my field, that's called a bad outcome. Or at least drags you in front of the M&M, committee. And the Chevalier also claims to have operated on Handel. That part is not historically verified. If it's true, however, then the Chevalier John Taylor can lay claim to having blinded the 2 greatest Baroque composers of the era. So looking across different cultures, there's some very interesting blind musicians. The blind Coptic cantors of Egypt have these very elaborate hymns that just take too long to transcribe into proper sheet music. So for centuries, these works have been handed down in an oral tradition by blind Coptic cantors. There's a great book, and it forms a teeny little piece in my book about blind Ukrainian minstrels. It's a large book that's written on the subject. And this is kind of a fascinating chapter in the Ukraine where these blind children were specifically recruited into this guild. And you could not play in this orchestra unless you were actually blind. They would hire a small child to be your guide, train you in music. This was a way of, trying to have people earn some sort of income in a very agrarian society. And the blind Ukrainian minstrels sort of abruptly stop in the 1930s because, as the story goes, Stalin invites them to a festival. He says, we're going to honor your heritage, honor your culture. He invites them to a festival, and so the story goes, he executes all of them. The Blind Orchestra of Cairo is kind of an interesting group of women. I'm going to just play a little video clip that explains it.
Amal Light and Hope Association was founded in 1954
everybody can hear
as the first center in the Middle East for the education, vocational training, care, and integration in society for the blind girl and women. The maestro only tells them to start.
First, we learn how to read the note in Braille, and we learn each symbol, each musical symbol in Braille. Then we memorize every note.
Abroad, we represent Egypt, and we represent the Arab world.
So there's a lot that I read about and researched and dug into about blind musical savants. So if you've seen the movie Rain Man and you see the depiction of an autistic savant, they usually have some profound disability and then something incredibly superhuman. So I want to play a couple of videos that are all kind of spliced together on blind musical savants as an overview.
And so is this next savant. He is Leslie Lemke of Milwaukee. He was born with a triple handicap: retarded, blind, cerebral palsy. Leslie, now 31, didn't walk much before he was 10 and only started talking a few years ago. And yet, his foster parents, May and Joe Lemke, have cared for him since he was 6 months old. May, you bought a piano for Leslie when he was blind, retarded.
When he was about 14 years old, they watched the Sunday night movie, which happened to be Sincerely Yours, and the theme song is Liberace's theme song, which is Tchaikovsky's first piano concerto. They watched, and Leslie listened because he's blind, and they went to bed. And then about 2 or 3 in the morning, May woke and heard some music coming, and she asked Joe, "Hubby, did you leave the television on?" "No." And so she went, and there was Leslie playing Tchaikovsky's first piano concerto from beginning to end.
Because he's so much bigger than me, but when Derek was born, he could have fitted on the palm of your hand. He was born 3.5 months premature, and really was a fantastic fight for him to survive. He had to have a lot of oxygen, and that affected your eyes, Derek. And so whenever you heard any note at all, if I just play a random note, you knew instantly what it was, and you got the ability as well to find that note on the piano. Now that's called perfect pitch.
Can you hold up 3 fingers for me?
I can do that.
Can you hold up 3?
I don't know how to do it.
You want me to show you 3?
Yes, please,
Okay.
yes.
Derek is a musical savant, blessed with an island of extreme talent in a sea of profound disability. How Derek's fingers can do this, but can't button a button or zip a zipper, remains a mystery.
So here, by the age of 11, Derek was playing things like this.
His progress was astounding. After 3 years of daily lessons, Derek was invited to play a few songs at a major charity fundraiser.
That people are reacting to his playing.
And he's been performing ever since, in jazz halls, at benefits, in churches, connecting with audiences in ways most musicians wouldn't dare, taking requests with a twist.
Would you like to have a piece, lady?
My piece is Ain't No Sunshine. Do you know it?
I do know Ain't No Sunshine.
And the twist? He'll play it in any key they choose.
B major.
B major,
B
Derek.
major.
Ooh, wicked.
And in any style.
What style would you like it in?
Ragtime. Ragtime.
Ragtime.
Okay, so Ain't No Sunshine, B major, ragtime.
Okay.
Remember, he had no idea what song would be chosen. No rehearsal. New key and new style. No problem.
In your brain, Derek, is this amazing musical computer that can instantly recalibrate, recalculate all the pieces in the world that are out there. Most pianists would have a heart attack if you said, sorry, do you mind playing Flight of the Bumblebee in B minor instead of A minor?
The featured piece in the performance was Gershwin's Rhapsody in Blue, a challenging piece for any pianist. Not to mention one who is blind and needs to handle intricate back and forths with the orchestra without the benefit of seeing the conductor.
You could almost physically sense the connection between him and the orchestra and the audience. The immense musicality and the power of his musical communication was just fantastic.
So that hopefully gives you a feeling for just this amazing talent. So he talked about perfect pitch. Well, perfect pitch is the ability to recognize a note without any reference note or any other comparison. That's prevalent in about 10% of musicians with a lot of training. In the blind, however, 60% of blind musicians have perfect pitch, even those who start kind of late, and 50 to 60% of blind children, even those who are not musicians, have perfect pitch. So it's a remarkable skill that seems to have an association with blindness. So how do we study blind musicians? How do we try to get at what is the underlying talent? Functional MRI is a technology many of you are acquainted with that measures brain activity. Unlike a structural regular MRI that just looks at what is the anatomy there, functional MRI uses technologies to figure out where is blood flowing, where's oxygen consumed, and highlights parts of the brain that are in high use during certain tasks. So for example, here's on the left are a bunch of scans from somebody who's asked in an fMRI scanner, do some calculations or a math task. Someone who's given a visual task of following a target or something like that, you can see it lights up a different area of the brain. This is kind of important because the area of our brain that processes visual information, the occipital lobes, the backmost part of the brain, and you can see these are lit up in a normal subject doing a visual task. So in musicians who have normal vision, who have perfect pitch, there's a very specific area of the brain that lights up on a functional MRI scan, here in the auditory cortex, also in the cerebellum, not shown here. Blind musicians who have perfect pitch, there is activity in a completely different area of the brain, including those visual association areas in the occipital cortex. And this, along with this, what I kind of call my money shot of, what is the secret to a blind musician's, talent, probably lies in the fact that if you take two groups, blind musicians and sighted musicians, and you do fMRI studies on them, you ask them to do auditory tasks, pitch localization, or find out where, locate it in space, any kind of auditory task, and then you subtract those two, and you say, what's the difference between these two groups? That's what this figure is getting at. And the difference is that auditory processing occurs in areas of the brain that in all of us in this room with vision, we use our occipital lobe to process visual information. Blind musicians use that occipital area as sort of an auxiliary, super auditory, computer. So this is what we call neuroplasticity, the ability of the brain to kind of rewire, reorganize itself. There seems to be a very critical period that this happens in early life, and then after that, plasticity declines. We know that the brain has these excitatory and inhibitory functions. There are people, including one of the professors in that little 60 Minutes piece, who talks about how there may be some way that if we understand really clearly what are the excitatory, the inhibitory functions. I forgot to mention that there's a very interesting syndrome, and Oliver Sacks kind of covers this, of acquired musical savants. So if you have a stroke or a tumor or an injury to very certain parts of the brain, you all of a sudden become a musical savant, unlike Leslie and Derek, who were born that way. An acquired savant syndrome is fascinating because it speaks to this ability of the brain to rewire itself, and possibly that imbalance between the excitatory and inhibitory areas may mean, as Dr. Treffert puts it, that we may be able to, without injury, without damage, we may someday be able to do something that he calls release the inner savant in all of us. So we've talked a little bit about the lives, the eye diseases, the music of blind musicians, trying to appreciate the connection between musical genius and savants. Two questions kind of come up, at least for me. So how would we treat their eye diseases today? Well, in every single case of the people that we've profiled, we have procedures, medicines, surgeries. We can cure every single disease that these people suffered from. So that brings up the question of what might have happened to their musical gift had they been born today. And I have to think that what we know about neuroplasticity and the way that that these people developed these, auxiliary computers in their occipital lobe, I would have to say that a sighted Stevie Wonder or a sighted Ray Charles would have been a very, very different musician, might not have even been a musician at all, had they not been born in the era in which they were born. So we live in a miraculous world of medical miracles and cell phones and everything else, and I just wanted to share that not only can we treat these diseases, we can now diagnose them with a cell phone or a camera. The picture on the top is a patient with a retinoblastoma, and it was diagnosed by a mother taking a picture of her baby and noticing that the red reflex that you normally see in a picture was white. That white reflex led her to the doctor. The doctor diagnoses it. We end up seeing the patient and treated. The picture on the bottom was actually sent to me by an employee and said, I think my cousin's baby has got something wrong. And it's like, of course, this baby has congenital glaucoma, the same thing that Andrea Bocelli and Ray Charles suffered with. The enlarged eyes, the cloudy cornea in the left eye. This is diagnosable now over a cell phone. So I want to leave you with a quote from Jacques Lucien, the writer and hero of the French Resistance. He went blind at the age of 7. He becomes a musician. He's listening to an orchestra one day. He talks about this synesthetic experience of listening to the blues of the flutes and the reds of the violas, and it's a wonderful passage. But then there's a little passage that really struck me, where he says, music was made for blind people. Anyway, it's been a pleasure to talk to you all. I'm happy to entertain questions. I know we're up against the time limit. Thank you.
What a terrific lecture. We have a few minutes for questions, and also there's going to be a book signing. And for those of you in the future who want to get a book, it's on Amazon, and we'll definitely facilitate the signing portion. Does anybody have any questions for Dr. Fish?
All right. Thank you all very much.